Hello, and welcome to MedicareMark, where you get clear solutions to your Medicare questions. MedicareMark is located in True Wealth Plaza. And in True Wealth Plaza, we have an educational center where we do live seminars. Our umbrella company is True Wealth Group. MedicareMark and RetirementMark fall under True Wealth Group. And I've been seen on CBS, Fox, NBC, ABC, CNN, and other publications like USA Today, Market Watch. We also have a podcast called the Medicare Minute. Please go online and look for the Medicare Minute and listen to our podcast. We have a webinar where you're going to learn the truth about Medicare. So I also have a #1 best-selling book, Thinking Outside the Money Box. And my new book, Tax Secrets Revealed, is also now #1 bestseller. Now, I believe family is first. Obviously, after health, you need health to survive. And once you have health, you can spend lots of time with your family. And that's what we do. This is us on a boat of friends after a karate tournament and going fishing. And on a Disney cruise with my whole family, my 4 kids, my wife, and my mother. There are me and my 4 kids on a love sack a couple years ago, and there we are at a water park. We also, for exercise and to stay fit, we also do karate. My son is the 5, 6, and 7-year-old national champion. My daughter is the 9 and 10-year-old national champion. We do AAU, USA Karate, and other karate leagues. Here's my daughter at the AAU Junior Olympics 2019. I got this off their page. They posted a picture of her. Here we are at the USA National Championship in Schaumburg, Illinois in 2019. Where Leva got 2 gold and a silver. But what's amazing is the 2 gold were up against 6-year-olds. And then when he did weapons, basically there was a 9 and under division, intermediate and advanced. There's 4 9-year-olds and 1 6-year-old. And Liam got 2nd place, and all the boys you could see were a head taller than him. Mia, out of 16 girls, got 2nd place in Kumite, which is fighting. And even I, overweight and old, have joined the team to, do things with my family. So in 2019 in Fort Lauderdale, the AAU National Championship, I got silver in weapons, which is Kabuto, a bronze in kata, and a gold in kumite. So here we are getting healthy, and we're spending time with family, and that's what life's all about. But I am a Medicare insurance expert. My name is Mark Lumia. I'm a licensed insurance agent and agency owner who's helped thousands of clients and counting get the most out of their Medicare coverage. As a guy with both parents on Medicare, I know just how important it is that you get to access the full benefits of your Medicare coverage. Before you make this really important decision, it always pays to be informed of what options are available for your specific needs and situation. I was also in a national publication, the USA Today. As you can see on the bottom right there, you see my picture. I was interviewed by Robert Powell to contribute to this full-page article in the Money magazine. Now here are more MedicareMark Medicare insurance experts. You got Roe and Kathy, Jose, Tom, Cindy, and Sterling. We also have Rick, Tina, Kelly, Scott, and Deborah. We serve Florida area. These agents pretty much work all of Florida. We do have agents in other states, so this is geared towards people in Florida. However, you can still learn if you're in other states, and if you are still interested in information, we can definitely help you. We do have agents in other states. So, as a 100% independent agency, I represent Medicare Supplement and Medicare Advantage companies. I am not controlled by any particular insurance company to steer a person on any one particular plan. My loyalty is to my clients. My mission is to get you the information you need for you to make a good, informed decision. And it's also what my agents do. At a glance, Medicare health insurance in Florida, there are more than 4.4 million Florida residents are enrolled in Medicare. 42% of Florida Medicare beneficiaries select Medicare Advantage plans. Residents in Florida can select from between 8 and 68 Medicare Advantage plans in 2019, depending on where you live. Only about a third of Florida's Medicare beneficiaries have standalone Part D prescription coverage, and pre-enroll Medicare spending in Florida is just slightly lower than the national average. As an unbiased and impartial educator, I also teach how to get the best Part D prescription drug coverage at the lowest prices every year. What we will cover on this webinar: we're going to cover how Medicare works and what it costs, which parts of Medicare you need, it's usually not all 4 parts, how, where, and when to enroll in Medicare to avoid penalties, what Medicare covers and what it doesn't, how Medicare coordinates with supplemental coverage to pay your cost share, and which doctors accept Medicare, and how to find participating doctors in your area. So when you're turning 65 and you're looking into Medicare, it can be very overwhelming when you turn 65 and you become eligible for Medicare for the first time. It is said to be one of the most confusing moments in a person's life. Now, even though we're talking about people turning 65, this webinar is for people, anybody that's really on Medicare, because you can learn a lot whether you're turning 65 or whether you're already on Medicare. Making a less than optimal choice in coverage can be costly, which could result in thousands of dollars of unnecessary out-of-pocket expenses. So, there's been a new report that says Confusing Medicare Search Tool. According to a new report from the National Council on Aging, NCOA, the Medicare.gov site is overwhelming, information is poorly presented, and the user design is potentially misleading, all of which confuses beneficiaries and can contribute to many making poor plan selections. So we're going to teach how to understand the Medicare and the different parts, and Medicare comes in 4 parts: Part A, B, C, and D. Each covers particular services or types of insurance. Virtually everybody who gets Medicare eventually enrolls in the first 2 parts, A and B, which have been around since the program started in 1966. Now, this is what the current Medicare card looks like. The Medicare card used to be your name, your social security number with a letter after it, and then hospital Part A and Part B. But so people wouldn't know what your social security number is, and to protect your identity, they now came out with a new Medicare card where you could see there's letters and numbers. And it's a good thing. And then you can see there's Part A hospital and Part B medical. So that's what the new Medicare card looks like. So let's get into Medicare Part A. Medicare Part A covers inpatient care in hospitals, limited skilled nursing care, hospice care services, and some home health services. Since most people pay Medicare FICA taxes, FICA, while they're working, 40 quarters for self or spouse, they won't have to pay a premium for the Medicare Part A. So if you work 40 plus quarters, you'll pay 0 per month for your Medicare Part A. If you worked 30 to 39 quarters, you will have to pay $252 a month. And if you worked 0 to 30 quarters, you will pay $458 per month for your Medicare Part A. You can enroll in Medicare Part A at any time within the 3 months leading up to your 65th birthday, the month of your 65th birthday, or any time within the 3 months immediately after your 65th birthday. Part A has inpatient hospital care. Inpatient care in hospitals for up to 90 days, semi-private room, meals, nursing services, hospital services, and supplies. Inpatient mental health coverage is limited to the 190 lifetime days. Coverage starts when you're admitted and ends when you have either been out of the hospital for 60 days or haven't received medical care in a hospital or skilled nursing facility. So, your gaps under Medicare Part A in 2020, you pay $1,408 deductible per benefit period. Now, benefit period is you're in the hospital, and after you get out and you're out for 60 days, a new benefit period starts, like I said above. So in 2020, you also, after you pay the $1,408 deductible, you then pay 0 per day for the first 60 days in each benefit period. If you're still in the hospital at that time, you would then pay $352 per day for days 61 through 90 of each benefit period, which could add up to $10,560. But if you're still in the hospital, you pay $704 per lifetime reserve day after day 90 of each benefit period, up to a maximum of 60 days over your lifetime. So you have 60 lifetime reserve days at $704 a day, which is another $42,240. So you can see that totals up to $54,208 of possible cost if you just have the Medicare card. So skilled nursing care. To qualify, it basically has to be a Medicare certified facility. You need a 3-day prior hospitalization, transfers within 30 days from the hospital discharge. Services in nursing home must be for a condition that was treated during hospitalization, and skilled care only, and requires daily basis for skilled care. So, you're covered for the first 20 days and they're paid in full. From days 21 to 100, you would have to pay $176 per day, and then after 100 days, there's no coverage. Now, home health care. To qualify, doctors must have determined client needs medical care in the home. Needed care must include intermittent, not full-time, skilled nursing care, or physical or speech therapy. Home health agency must be Medicare approved. Homemaker services such as cooking, cleaning, shopping are not covered. So, 100% of medically necessary Medicare approved home health care visits and 80% of Medicare approved charge for durable medical equipment, wheelchairs, hospital beds, oxygen, and walkers. And now hospice care. Medical and support services at home, drugs for symptom control and pain relief, inpatient respite care to give you a break, 5% coinsurance, and care given to a hospice patient in a facility so the usual caregiver can rest. So now we have Medicare Part B. And Medicare Part B will cover doctors' office visits, most outpatient hospital care, laboratory services, diagnostic testing, preventative care and screenings, durable medical equipment, physical therapy, and some types of home health care. So they have preventative care covered under Part B, which is an annual routine physical exams, glaucoma test, smoking cessation, diabetes screenings, HIV screening, cardiovascular screenings, flu and hepatitis B shots, many cancer screenings, and diabetes self-management training. Part B has a monthly premium. The standard Part B premium amount in 2020 is $144.60. However, individuals with income above $87,000 and couples with incomes above $174,000 pay a higher Part B premium. They look at your modified adjusted gross income as reported on your IRS tax return from 2 years ago. Premiums will automatically be deducted from your Social Security benefits if you're currently drawing Social Security. If paying by check, you must pay quarterly. So that would be $144.60 times 3, and you pay by check quarterly if you're not already collecting your Social Security and you don't plan on collecting it when you're getting on Medicare. You can set up monthly EFT auto pay from checking or savings account. They use a sliding scale to make the adjustments based on your modified adjusted gross income or your MAGI. Your modified adjusted gross income is the total adjusted gross income, AGI, and tax-exempt interest income. So as you can see, for individuals' a tax return, which is $87,000 or less, or filing a joint tax return, which is $174,000 or less, you would pay $144.60 per month for your Medicare Part B premium. However, if you're filing jointly and you're above $174,000 up to $218,000, you would now pay $202.40 for your monthly premium. And once you get above $218,000 all the way up to $272,000, now your Part B premium goes up to $289.20 a month. Above $272,000 up to $326,000, you're now at $376 a month. If you go above your modified adjusted gross income, $326,000, however, it's less than $750,000, Now you're paying $462.70 per month. And anyone that's filing a joint tax return that's above $750,000 will be paying $491.60 for your Medicare Part B Premium. Most people pay the $144.60, but if you're blessed to be making more income, you will have to pay a higher premium for your Medicare Part B. And once again, they look back 2 years and look at the tax returns from 2 years ago. Once your income drops down, you can drop down into a lower monthly payment. So, Medicare Part B cost. You will pay for services out of pocket until you reach the amount of your annual deductible. The Part B deductible is $198. After that, Medicare will cover 80%, and you're responsible for 20% of the services as part of your co-insurance share with Medicare. So you're going to pay the first $198, and then you're responsible for 20%. Now, on the Medicare and You 2020, there's a page 21 where they talk about late enrollment penalty for your Part A. So if you aren't eligible for premium-free Part A because you didn't work 40 quarters and you don't buy it when you're first eligible, your monthly premium may go up 10%. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. Here's an example. If you were eligible for Part A for 2 years but didn't sign up, you have to pay a 10% higher premium for 4 years. Now, there is also a Part B late enrollment penalty on page 22. If you don't sign up for Part B when you're first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. Your monthly premium for Part B may go up 10% for each full 12 months in that period that you could have had Part B but didn't sign up for it. So, if you're allowed to sign up for Part B during a special enrollment period, you usually don't have to pay a late enrollment penalty. Now, here's an example for the Part B late enrollment penalty. Mrs. Smith's initial enrollment period ended December 2016. He waited to sign up for Part B until March 2019 during the general enrollment period. His coverage will start on July 1st. So if you don't have Medicare and you want to sign up, between January 1st and March 31st, you're allowed to sign up, but it doesn't go into effect till July 1st of that year. So his Part B premium penalty is 20%, and he'll have to pay this penalty for as long as he has Part B. Even though Mr. Smith wasn't covered for a total of 27 months, this included only 2 full 12-month periods. Many people thinking about Medicare enrollment experience stress. Adding to that stress is a variety of Medicare myths and misunderstandings. Perhaps one of the biggest myths is, I must enroll in Medicare at age 65 no matter what. Let's look at a few facts of Medicare enrollment. Fact number 1, those who are already receiving Social Security benefits before age 65 will be enrolled in Medicare automatically when they turn 65. They do not have to do anything. They will get their Medicare card in the mail usually around 3 months before the month they turn 65. Fact number 2, those who plan to enroll in Social Security at age 65 must also enroll in Medicare. In both cases, already on Social Security or just signing up for it. Enrollment in Medicare, at a minimum, Part A, hospital insurance, is required because it is a condition of receiving benefits. If you don't want Medicare, then you can't get Social Security. Now, when you're turning 65 and you're already collecting Social Security and they automatically mail that Medicare card to you, that card will have Part A and Part B on it. Some people, because they're still working, will send the card back. They'll take the Part B off and they'll send you back a card with just Part A only. Fact number 3, those who do not plan to enroll in Social Security at age 65 and who have an employer group health plan, be it as the employee or dependent, can delay enrolling if the coverage meets 2 criteria. The company with 20 or more employees sponsors the group health plan, and the owner of the policy is still working. When it's time to retire, these individuals can qualify for a special enrollment period. They can enroll in Medicare without delay or penalty. Because they had credible coverage, there's no delay or penalty. Part D, Medicare Prescription Drug Plan. Original Medicare, the Part A and Part B, doesn't include coverage for most prescription drugs, but Medicare Part D prescription drug plans exist to help provide coverage for both generic and brand name drugs. Medicare Part D, voluntary coverage for retail outpatient prescriptions. Part D does have a late enrollment penalty of 1%. It's 1% of the national average premium for every month you waited. So in 2020, the Part D national base beneficiary premium is $32.74. So for the Medicare New 2020, the Part D late enrollment penalty is on page 77 to 78. The late enrollment penalty is an amount that's permanently added to your Part D premium. You may owe a late enrollment penalty if at any time after your initial enrollment period is over, there's a period of 63 days or more in a row when you don't have a Part D or other credible prescription drug coverage. You'll generally have to pay the penalty for as long as you have Part D coverage. Note, if you get extra help, you don't pay a late enrollment penalty. Some people are on Medicare and Medicaid. They get extra help from the state, and in that case, there would not be a late enrollment penalty. There are 3 ways to avoid paying a penalty. Number 1, you could join a Medicare drug plan when you're first eligible. Even if you don't take prescriptions now, you should consider joining a Medicare prescription drug plan or a Medicare Advantage plan that offers drug coverage to avoid a penalty. You may be able to find a plan that meets your needs with little to no monthly premium. Number 2, you can enroll in a Medicare drug plan if you lose other credible coverage. Credible prescription drug coverage could include drug coverage from a current or former employer or union, TRICARE, Indian Health Service, the Department of Veterans Affairs, or individual health insurance coverage. Your plan must tell you each year if your drug coverage is credible coverage. If you go 63 days or more in a row without a Medicare drug plan or other credible prescription drug coverage, you may have to pay a penalty if you decide to join later. And number 3, keep records showing when you had credible drug coverage and tell your plan if they ask about it. If you don't tell the plan about your credible prescription drug coverage, you may have to pay a penalty for as long as you had Part D coverage. The cost of the late enrollment penalty depends on how long you didn't have credible prescription drug coverage. Currently, the late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium, which is $32.74 in 2020, by the number of full uncovered months that you were eligible but didn't join a Medicare drug plan and went without other credible prescription drug coverage. The final amount is rounded to the nearest 10 cents and added to your monthly premium. Since the national base beneficiary premium may increase each year, the penalty amount may also increase each year. After you join a Medicare drug plan, the plan will tell you if you owe a penalty and what your premium will be. And here's an example. Miss Martin didn't join a drug plan when she was first eligible by June 2017. She doesn't have prescription drug coverage from any other source. She joined a Medicare drug plan during November 2019, and her coverage began on January 1st, 2020. Since Miss Martin was without credible prescription drug coverage from July 17th through December 2019, her penalty in 2020 is 30%, 1% for each of the 30 months of $32.74, the national base beneficiary premium for 2020, which is $9.82. The final amount is rounded to the nearest 10 cents, so she'll be charged $9.80 each month in addition to her plan's monthly premium in 2020. She'll continue to pay a penalty for as long as she has Part D coverage, and the amount may go up each year. Here's the math. 0.30, which is the 30% penalty, times $32.74, which is the 2020 base beneficiary premium, equals $9.82. So $9.80 is Miss Martin's monthly late enrollment penalty for 2020, rounded to the nearest 10 cents. These plans help cover most commonly prescribed drugs and are provided by private insurers. So while Medicare requires each company to cover every therapeutic class of drugs, each plan has its own list of select brand name and generic covered drugs, called a formulary. They are not required to carry every name brand, so be sure to check your plan's formulary every year if you take a particular name brand drug. Now, some companies will actually have multiple formularies because they have multiple plans. Sometimes they have several plans in one formulary, and other times there might be a formulary for many different plans. So let's say a company has 10 different plans, they could possibly have 4 different formularies. So each company could have multiple formularies. So you definitely want to check your drugs every year because the formularies can also change. So there are 27 standalone Part D plans, and premiums vary by plan in the state of Florida. Currently in 2020, the lowest is $13.20 a month, $13.20 a month, and the highest is $156 a month. And next year in 2021, the $13.20, which 2 companies have, will go up to $14.60 on one company and $17.20 on another. So we'll be glad to help you figure those things out. You just need to give us a call and we can help you plug in your drugs and find out which is the best Part D plan for you. Now, individuals with income above $87,000 and couples with incomes above $174,000 will pay a higher Part D premium. Remember, earlier we were talking about Part B as in boy premiums. Now, this is Part D premiums for the drugs. So you can see if your income is above the $174,000 as a couple, you would have to pay an extra $12.20. And if you get above $218,000, it's $31.50 extra. Above $272,000, an extra $50.70 a month. Above $326,000, $70 more a month. And if you get $750,000 and above, you're paying an extra $76.40 for your Part D coverage. So these are called income-related adjustments, and it happens on the Part B as in boy and the Part D as in dog. Now, drug formularies usually have 5 tiers of meds. Some formularies will only have 4 tiers and some have 6. So it just all depends on the company and the plan within that company, because even companies, their plans within those companies could have 4 tiers, 5 tiers, or 6 tiers. Now, generally when you have tier 1, it's a generic. But some companies will take that tier 1 and break it into 2 different tiers. So as you see in this example, tier 1 is a preferred generic and tier 2 is a non-preferred generic. Well, if a company only has 4 tiers and their tier 1 is preferred generic, you're comparing tier 1 and 2 versus the tier 1 of the other company. Now, tier 3 on this company is preferred brands, but on the other company, tier 2 is preferred brands. So now you're actually comparing tier 3 versus tier 2. And if you have a tier 4, a non-preferred brand, or a tier 5, a specialty medication, what I'm trying to say here is don't look at the number of the tier, look at the words. So if it says preferred generics, non-preferred generics, preferred brand, non-preferred brand, and specialty medications, you're going to be comparing really the words and not the tiers. There are 4 stages for Part D, and the first stage is a deductible, and then you get into the initial coverage stage, the coverage gap stage, and the catastrophic coverage, and we'll go over those right now. Stage 1, deductible example. Let's say your plan has a $435 deductible, and the medication costs $100, so you pay $100. Now you have only $335 left until you satisfy your deductible and reach the initial coverage level. But some companies don't have a deductible. They have a 0 deductible, so you're in the initial coverage level right away. Stage 2, the initial coverage level. So you pay your copay. Insurance company pays the rest. So how do they get money to pay for the Part D coverage? Well, a lot of it comes from the general Medicare revenues of 71%. The premiums for beneficiaries is 17%, and state payments for people with Medicare and Medicaid, 12%. And this comes from the sources of the Kaiser Family Foundation. So Medicare also, they'll track the spending. So your cost plus the insurance company costs, and the retail cost reach is $4,130. So they're going to take how much you spend and how much the insurance company spends. And once you both spend $4,130 combined, you're now in stage 3, the coverage gap. And in the coverage gap, generics and brand name drug medications, you would have to pay 25% of the cost of the generic and the brand name medications. So if the retail cost of the drug was $400 and your initial coverage cost is $50, which is copays and coinsurance, which vary by plan, and you can consult your drug formula because everyone has a different copay, your gap cost would be $100. You're no longer paying the $50 copay. The retail cost was $400. Now that you're in a gap, you have to pay 25% of the $400 or $100. You're no longer paying the copay. So once you reach stage 4, which is catastrophic coverage, that's after the retail cost reaches $6,550. Then you're only going to pay around 5% of the cost of your covered medications for the rest of the year. And here's a summary of the Part D donut hole, or the coverage gap. So you can see for standard plans, you have an up to $435 deductible in drug spending, and some companies, once again, are zero. And the initial coverage phase, up to $4,130 in total spending, you and the insurance company, and then you get into the coverage gap, which is between the $4,130 up to the $6,550, and you're basically paying 25% for the brand names and for the generics in the coverage gap. And then you get to catastrophic coverage. Once you spend $6,550 out of pocket, you're going to pay the higher of 5% or $370 for a generic, or 5% or $920 for a brand. And then the plan resets the next year. So you're basically paying that maximum of 5% or whatever's higher up until the end of the year, and then it resets. Now, prior to the enactment of the Affordable Care Act, when you got in the gap, you had to pay 100% of the coverage of the drugs once you got into the gap. There's something called annual election period. It's from October 15th through December 7th, and your new coverage usually begins in January of the following year. So what do we have covered? We covered Part A hospitalization, Part B doctor, and if you got a D or a Part D plan for drugs. That's original Medicare with purchasing a drug plan. So you still have those gaps in copayments, and that can be a significant amount of money. However, you can see any doctor, specialist, or hospital in the country that accepts Medicare, which is 96% of participating doctors. There are no referrals needed or networks to worry about when you're on traditional Medicare and have a Part D plan. At this point, now that you have a Medicare card, you have two options on how to receive your healthcare benefits. You can go with the original Medicare, the Part A and Part B, and then purchase a supplement to cover those gaps and a Part D plan to cover the drugs. Or you can get in a Medicare Advantage Part C plan, they call that MAPD, Medicare Advantage with prescription drugs. And those are your two choices. Original Medicare with a supplement and a drug plan, or a Medicare Advantage plan that has drugs. So Medicare Advantage Part C. So we covered A and B, we covered Part D, which was drugs, and now we're going to cover Medicare Advantage Part C. A Part C plan is a Medicare Advantage plan. It could be an HMO, a PPO, a private fee-for-service, special needs plan, Medicare cost account. So Medicare Advantage plans work with original Medicare. Medicare pays a fixed amount for your care each month to the private companies offering the Medicare Advantage plans. Each Medicare Advantage plan can charge different out-of-pocket costs. They can also have different rules for how you get your services, like whether you need a referral to see a specialist, if you have to go to doctors, facilities, or suppliers that belong to the plan for non-emergency or non-urgent care. These rules can change each year. These plans typically have a lower monthly premium. Many have a zero premium and include drugs at no additional cost. However, your costs will include copayments, deductibles, and coinsurance when you use the plan. Both your premium and your annual out-of-pocket costs will vary depending on the plan you choose, with a MOOP maximum of $6,700 per year for HMO, and MOOP stands for maximum out of pocket, and $10,000 per year for PPOs. Some would go as low as $1,900 maximum out of pocket. Unlike original Medicare, which allows you to see any doctor who accepts Medicare without any referrals, some Medicare Advantage plans will require you to use their network doctors and require referrals to access a specialist. Some don't require referrals, and others will let you go out of network at a higher cost. Also, Medicare Advantage plans might have additional benefits that regular Medicare doesn't, like dental, vision, hearing, gym memberships, acupuncture, transportation, and over-the-counter items. They give you an allowance per month or per quarter. Original Medicare does not have prior authorization requirements. Doctors and other healthcare providers follow Medicare coverage criteria. They determine the appropriate plan for their patients. Original Medicare does not require referrals. A beneficiary simply goes to a provider who accepts Medicare assignment. Medicare supplement plans are also known as Medigap because they cover the gaps not covered by Part A and Part B of Medicare. So, Medicare supplements, basically, they're a health insurance policy. They're sold by private insurance companies. They follow federal and state laws designed to protect seniors. They cover gaps in the original Medicare plan, and there are currently 8 standardized plans. There used to be 10, but this year, in 2020, January 1st, they no longer will let people get on Plan C or Plan F for those people that became eligible after January 1st, 2020. There will be some people still on Plan C or Plan F because they qualified before January 1st, 2020. So, your cost sharing in 2020. So, if you just have Medicare Part A, you would have a Part A deductible of $1,408. And then for the first 60 days, you would pay nothing additional. But starting on day 61, you would pay $352 a day, all the way up to day 90. And on day 91, you have 60 lifetime reserve days that are going to kick in. And you're going to have to pay $704 per day. And then after day 150, you have to pay all the costs. You also pay for the first 3 pints of blood, and you pay for $176 a day for days 20 through 100 in a skilled nursing facility. Now on Part B, you have a Part B deductible of $198. And then you pay 20% coinsurance. And there is no out-of-pocket cap. So once again, Medicare supplement plans, also called Medigap. Medicare is your primary insurance. It is Medicare that approves your healthcare procedures, not the supplement insurance companies. All doctors and hospitals bill Medicare first, and all supplement plans are required by law to pay the Medicare gap balance. This is what the Medicare and You 2020 guide looks like, and in the book, I've already quoted several pages on late enrollment penalties. In the 2015 CMS Medicare and You, it says, as you shop for a Medigap policy, keep in mind that different insurance companies may charge different amounts for exactly the same Medigap policy, and not all insurance companies offer all Medigap policies. Once again, in the 2015 CMS Medicare and You, it says there can be big differences in premiums that different insurance companies charge for exactly the same coverage. So once again, these plans are standardized. Plan G with one company is exactly the same as Plan G with another company. So why pay $100 more a month for a Plan G from the most expensive to the cheapest if you can get it for a lower price? So Plan C and F are no longer available after January 1st, 2020. Congress schedules end to insurance coverage for Medicare Part B deductible. You must pay the Medicare Part B deductible of $198 for 2020 and after. So what is not covered by Medicare? Most dental care, eye exams related to prescribing glasses, hearing aids and exams for fitting them. Foreign travel emergency is not covered. Custodial care, which is bathing, dressing, and eating, etc., is not covered. Long-term care, cosmetic surgery, Most chiropractic services aren't covered. Routine foot care, acupuncture, no dentures, no massage therapy, routine physical exams, or concierge care, also called concierge medicine, retainer-based medicine, boutique medicine, platinum practice, or direct care. These things are not covered by Medicare. So once you become a lifetime client of ours, we have the lifetime client service support. After you enroll in a Medicare insurance plan, a member of our client service team will reach out to you in a few weeks after your effective date. We'll confirm you've received your policy and your ID cards, and we'll answer any questions you may have about using your new benefits and give you a direct contact number for our client service team where you can call to get immediate help on anything from something as simple as reordering a lost ID card to something complex like reconciling claims after a long hospital stay. Whatever you need, we'll help you through it. We'll also help you with claims research and resolution, and the annual Part C and Part D analysis, and the supplemental insurance analysis every year will help you look into the changes between October 15th and December 7th, which is the annual election period. We'll review all your policies. Some people will call, make an appointment to see the new benefits for the next year of their plan. Some people will just say, hey, I'm going to stay on my current plan. Other people want to know what the changes are. Some people want to see what the competition is doing. We can do that by phone, by webinar. We can do it in person at the office or even at your house. So at MedicareMark, however, we will always help our Medigap policyholders with their Part D needs and our Medicare Advantage Part C policyholders. We go through Medicare certifications each year to be qualified to help you review your Part C and Part D plans each fall during the annual election period. So if you have any questions, please email us at mark@medicaremark.com. You can call us at 1-352-561-4571, or it'll still ring if we dial 1-800-762-7572, which is actually 1-800-7-MARK-72. Once again, 1-800-7-MARK, M-A-R-K, 72. Or you can visit us at www.medicaremark.com. Thank you for watching the webinar. We look forward to working with you, and please look at our other resources. We have the podcast I told you, the Medicare Minute, and we have other things on our website at MedicareMark that will help you in making informed decisions. We help at MedicareMark. We give you clear solutions to all your Medicare questions. Have a great day.